Nobody should ever die from colon cancer. That is according to longevity expert Dr. Peter Attia. The reason for that bold statement is the progression from non-cancer to cancer is visible to the naked eye through the transition of non-malignant polyp to malignant polyp if you get routine colonoscopies. According to the Mayo Clinic, a colon polyp is a small clump of cells that forms on the lining of the colon. Most colon polyps are harmless, but over time, some colon polyps can develop into colon cancer. Colon cancer can be fatal when found in its later stages. That's why early detection is everything. But here's where we stand right now. Colon and rectal cancer, together known as colorectal cancers, are the third most common type of cancer in men and women, resulting in nearly 50,000 deaths per year. It's also the second leading cause of cancer death worldwide at 9.4%. In 2020, there were about 600,000 people in the US that died of cancer. And in May 2018, the American Cancer Society updated its colorectal cancer guidelines based on a modeling analysis, recommending regular screening begin at age 45 for people at average risk, which is the most aggressive of the major institutions. Longevity expert Dr. Peter Attia screens patients starting at age 40 even if they have no history of colon cancer. You have to get ahead of it. Just keep in mind that Black Panther star Chadwick Boseman died from colorectal cancer at the young age of 43. And recent survival rate data showed that more than 90% of people treated for early stage colon cancer were alive 5 years after diagnosis. Again, early detection is your most powerful tool when it comes to colorectal cancer. If you had a colonoscopy every 1 to 2 years, the likelihood that you could ever develop a colon cancer, while maybe not zero, is so remote that you could effectively take colon cancer off the list of the top 10 reasons why someone dies of cancer, says Dr. Peter Attia. That is quite the statement. But outside of getting a colonoscopy every 1 to 2 years, here are 10 early warning signs of colorectal cancer you need to look out for. Number 1, sudden and unexplained weight loss. While a majority of people are trying to lose unwanted weight, sudden and unexplained weight loss isn't the type of weight loss you'd want to experience. It's often a general symptom that something isn't right with your body and needs further testing to find the root cause. Colorectal cancer can lead to sudden and unexplained weight loss in a couple of ways. What all types of cancer have in common are abnormal cells. These cancerous cells divide, proliferating and crowding out healthy cells, a process that taps into the body's energy source, which then causes people with cancer to burn more calories at rest. At the same time, the immune system also uses extra energy as it works hard to fight the disease. This starts to deplete the body's resources. That's why between 31% and 87% of cancer patients say they experience unexplained, unintentional weight loss. The weight change that precedes a cancer diagnosis is typically a loss of 10 pounds or more. And sometimes, the weight loss isn't a direct result of the disease, but how it affects the patient's desire to eat, oftentimes resulting in a loss of appetite, eating habits, and the way the body processes and absorbs food. Those actions may lead to unwanted weight loss. The next sign is chronic fatigue and weakness. Between work and personal obligations, everyone can feel run down at certain times. But if the exhaustion doesn't go away with rest, you wake up feeling like crap every day, it could be something else. Chronic fatigue and weakness is typically a symptom of an underlying problem. Similar to unexplained weight loss, cancer cells can cause fatigue as they use up the body's energy. In addition to colorectal cancer, fatigue and weakness could also be symptoms of diabetes, kidney disease, anemia, and heart disease. It's absolutely not normal to feel like crap all the time. If that's the case, it's time to see a doctor. The next warning sign of colon cancer is anemia. Anemia is present in 43% of patients with colon cancer. Iron deficiency anemia is the most common extraintestinal symptom in patients with colorectal cancer. Some common symptoms of anemia are fatigue, shortness of breath, racing heart, and paleness. In short, you just don't look and feel right. Severe anemia is also important for predicting highly advanced cancer. The next sign is abdominal cramps. People experience abdominal pain at some point in their lives for various reasons. Whether it's food intolerance, food poisoning from eating contaminated lettuce, stress, all the way to non-cancerous conditions like hemorrhoids and irritable bowel syndrome. However, abdominal pain that began recently and is severe and long-lasting can be a sign of something more serious, like cancer. Colon cancer occurs in the large intestine, which can affect bowel movements. This change in bowel habits can lead to cramping, bloating, and abdominal pain, all possible indicators of colon cancer. The next signs are blood in your stool, bleeding from the rectum, and/or change in the appearance of the stool. One of the most alarming symptoms of colorectal cancer is bleeding from the rectum or blood in the toilet. Other conditions like hemorrhoids or fissures can also cause small amounts of blood. If you notice blood in the toilet, you need to see a doctor as soon as possible. It might even be time to go to urgent care. The next sign is change in bowel habits. Again, a colon polyp, a small clump of cells on the lining of the colon, can develop into cancer over time. Once the polyp turns into cancer, the slow growth of the tumor often affects bowel habits. If you've noticed your stool becoming thinner, narrow, or ribbon-like, it could be an indication of changes inside your colon. A noticeable change in the frequency of bowel movements could also be a sign of colorectal cancer. Also, pay attention to the color of your stool. If you notice blood in the stool or darkened or tarry stool, that could also be an indication of changes inside the colon. Again, it's time to go to your doctor if that's the case. Change in stool consistency is also another sign. Colon cancer can hinder the large intestine's ability to perform its usual tasks, like getting rid of waste and absorbing water and nutrients. Drastic changes in the consistency of stool can be an early sign that something isn't quite right in your stomach. Loose, watery stools, diarrhea, or constipation unrelated to another condition can be a symptom of the disease. Next, family history also matters. Ask your parents if close relatives have battled colon cancer before. Genetics, albeit a small percentage, can play a role in your risk for developing it. Having said that, the majority of people, about 70%, who are diagnosed with colorectal cancer under the age of 50 don't have a family history or hereditary conditions. The biggest takeaway here is be proactive about your health. Like all cancers, treatment is the most successful when colorectal cancer is caught in its early stage. In addition to colonoscopies and regular screenings, recognizing the common signs and symptoms of colorectal cancer can save your life. Other supportive lifestyle choices to help with cancer prevention are things like maintaining a healthy weight. At least 13 different cancers have been linked to weight gain and obesity, including colon cancer. Next, don't smoke. Smoking is linked to 15 different cancers, including colon cancer. Plus, smoking increases the risk of other serious diseases like heart disease, stroke, and lung problems. Severely limit alcohol intake, preferably zero, because even low amounts of alcohol can raise the risk for colorectal cancer and breast cancer. Next, chronic stress is insidious when it comes to disease. You can manage it by spending as much time in nature and having a supportive community. Next, you want to maintain an active lifestyle and do resistance training a couple of times a week to build and maintain muscle. Going from unfit to having an average level of fitness can give you as much as a 3x reduction in mortality. Next, sleep is the foundation of health. Get adequate and quality sleep, 7 hours minimum. Lastly, severely limit ultra-processed food intake because they're highly inflammatory. Chronic inflammation is the root cause of a lot of disease, including cancer. Instead, revolve your diet around single ingredient, minimally processed, nutrient-dense food. Real food. Now, if you enjoyed this video, then you don't want to ignore this one. I'll see you there.